Namaste, Suprabhatam, everybody. This is Dr. Mayur Kaku. I am neurosurgeon and at the same time I am a yoga therapist as well. I first of all, with whole heart, thank all of you for making this YouTube family 5,000 plus. We are now 5,000 plus YouTube family. On this, we have shared the knowledge of yoga, knowledge of neuroscience, shared beautiful experiences of many of you. And with that, we have been growing together, we have been improving the consciousness of society, consciousness within ourselves, and then through that, the consciousness of the society. So thank you very much. I cannot point out who helped how, but all of you somewhere have been phenomenal in helping and growing this journey. So thank you very much once again. Now, coming to the beneficiaries of yoga and admirers of yoga. So recently I saw one patient from Kolar and they were very much impressed with the idea of yoga being the medium to prevent surgery of the spine. And unfortunately, they had already undergone surgery of the spine. And as we all know, and as we have observed, that over a period of time, he developed problems again, and he is not able to walk. He is on wheelchair. He has a lot of pain. So I had promised his sons that on this weekend I will create a video on back pain. Then they told, sir, our mother has knee pain also. I told, okay, on Sunday, we will address the issue of knee pain, like that. So these are the two things which we are going to do. Today, we are going to do back pain related practices and understand what back pain is and how it can be, understood better and then practiced better. That is one. And then second thing is that tomorrow, we are going to address the issue of knee arthritis. Many of you are young here, many of you are in your 20s, in your 30s. I request all of you that these 20s, 30s are going to go, and then you will be entering into 40s, 50s, 60s, and 70s. And as we save money for our old age, the same time we have to save our health for old age. So we should always remember this. Also, yesterday, two important, very interesting aspects happened, and some interesting quote came from my own, thinking process. And then I thought of sharing with you because it is the eruption of consciousness. So all of us as collective consciousness should benefit from it. Many of us get bogged down or get affected by the outer noise. It means it, as a patient also, many of the patients will get bogged down. Oh, this is my back pain, this is this disc prolapse, or this, that, or this is knee arthritis, or doctors have told surgery is compulsory, this, that. And somewhere we decide that, okay, this is it. I have to undergo surgery. This is it. This is my fate. So this outer noise suppresses the inner music. So this inner music, we have to always keep on playing. Always we have to make the voice of our inner music louder and louder. Okay. Here with us, so many of elderly are there, and we know that their inner music is far greater than the outer noise, and that is how they all have been leading a healthy and happy life, and they are spreading also health and happiness. So I sincerely bow down to all the elderlies in our journey of yoga and in the YouTube family who are beneficiaries of this journey. And yes, if you feel this works, this helps, please do share, and please do be a part and make many more other people part of this journey of Brahma Muhurta Yoga. leading to collective consciousness, leading to Maharshi effect, and ultimately benefiting the whole life on the planet. Okay. Thank you very much, everybody. Let us start today's session. Close your eyes. The other thing I will tell at the end of the video. Close your eyes. Make your inner music louder than the outer noise. So forget all the tensions and worries and focus only on your breathing. When we inhale, abdomen is bulging. When we exhale, abdomen is sinking down. With each breath, we are becoming more and more relaxed. Slowly, let us bring awareness towards tip of the index fingers and thumbs. While feeling the pulse, we move on to the center of the chest. When we inhale, the chest is expanding. When we exhale, the chest is collapsing. With each breath, we are becoming more and more relaxed. Slowly, let us bring awareness towards your nostrils. When we inhale, cool air is going inside. When we exhale, warm air is gushing out. With each breath, we are becoming more and more relaxed. Slowly, let us bring awareness towards center of the eyebrows. Let us visualize one beautiful Omkara of any size, of any shape, of any bright color. While focusing on this Omkar, we are going to chant it 3 times. Inhale. Om. Feel the effect of Pranava Omkar on your mind and body. Excellent. Visualize beautiful Mother Earth in the form of a globe. Visualize beautiful Mother Earth in the form of a globe. Visualize beautiful cosmic energy trickling down towards Mother Earth, doing Abhishekam of Mother Earth. Visualize that through this cosmic energy, all the beings on the planet receive peace, prosperity, health, and happiness. Enjoy this beautiful experience. Peace, prosperity, health, and happiness. शांति, समृद्धि, स्वास्थ्य और आनंद की प्राप्ति हम सभी को हो रही है. Gently, let us bring our awareness towards individual self. Let us visualize the whole body receiving cosmic energy through the top of the head. Visualize, visualize, visualize. From inside out, feel this cosmic energy. Each and every cell has achieved great physical, mental, social, and spiritual health. Slowly, let us bring awareness that our individual self is glowing like Bhagavan Sri Surya from inside out. Feel that all the negativity is released, only positivity. Visualize the release of negativity. Visualize the radiance of positivity. And as we do that, we realize we are not just this body. We are beyond this body. We are continuously transforming from one form to another. And it is a continuous process where it involves energies traveling across the universe. Simplest example is solar energy reaching to all of us through food, and it travels 14 crore 40 lakh kilometers. Just as the smallest and simplest and easiest example for all of us to understand that this human body is the result of energies getting transferred from crores and crores of kilometers. The reality, as we receive it, as we understand it, is far different from our own understanding. That is why allow your subjective phenomenon, the individual phenomenon, to release and merge with the cosmic consciousness. Aham Brahmasmi. I am the universe. Tattvamasi. I am that supreme consciousness which is all pervading. Prajnanam Brahma. The knowledge acquired through sadhana helps me to reach the supreme consciousness. I am Atma Brahma. I am the individual representation of supreme consciousness. Sarvam Khalvidam Brahma. Everywhere there is presence of supreme consciousness. Om Aham Brahmasmi. Om Tattvamasi. Om Prajnanam Brahma. Om Ayamatma Brahma. Om Sarvam Khalvidam Brahma. Enjoy this beautiful experience. Let us visualize our sankalpa of reaping Maharshi effect through at least 1 crore people doing the sadhana of Brahma Muhurta Yoga together, the collective consciousness meditation together. Let all of us resolve to bring 1 crore people together and practice Brahma Muhurta Yoga. Visualize that beautiful experience. Visualize your own self as a Brahma Muhurta Yogi. I am a Brahma Muhurta Yogi. Feel that joy of being a Brahma Muhurta Yogi. Gently adopt Namaskara Mudra, Omkar followed by Sahana Bhavatu. Sahana Bhavatu, Sahanau Bhunaktu, Sahaviryam Karavavahai, Tejasvinavadhitamastu Mavidvishavahai. Om Shanti, Shanti, Shanti. With your eyes closed, slowly take your both the hands back. Hold your right hand with the left palm. Inhale, arch your back. Exhale, bend forward. Touch your forehead to the ground. Express gratitude to Mother Earth Almighty, your parents and you. Slowly inhale and come up. Slowly release your hands. With few blinks, you may open your eyes. Once again, welcome everybody to Brahma Muhurta Yoga. Thank you very much for joining in. Now, we will think that we are a back pain patient. Okay? And accordingly, we will try to address the issue. Okay? That's what we are going to do. Before that, let me just share some simple anatomy knowledge of spine so that all of you can understand it better, and at the same time you can practice it, and you can just a second. Very simple things I would like to show. Just a second. It is. Just a second. Okay, are you able to see? Are you able to see this?
Yes, doctor.
Okay, thank you. So see here, the spine is made up of small bones which have very beautiful structure, And you can see there are particular curvatures of the spine. Okay, there is cervical curvature, there is thoracic curvature, then there is lumbar curvature, and then there is pelvic curvature. So these vertebrae are called as cervical vertebrae, these are called as dorsal vertebrae or thoracic vertebrae, and these are called as lumbar vertebrae. These are called as sacrum, and this is small piece is called as coccyx. Okay. Now, wherever there is joint and wherever there is movement, there will be friction. Okay. Now, from this friction, and because we are, this is the MRI view. So you can see these burger patty kind of things are called as discs. Okay. And these discs, they help the spine to move. So that is why we have this flexibility. Okay. And inside this, there is something called as a spinal cord. It is as important as brain because it carries the information from brain to the rest of the body. At the same time, it carries information from rest of the body to the brain. That's why it's extremely important. We can't deny the fact of and importance of spinal cord. Actually, it is more important than brain. Somewhere I feel like that. Okay. And this spinal column is kept in a proper posture. Most important thing is posture. Is kept in proper posture through various muscles like these, which are attached to the spinal column. Okay. And these muscles, as they grow weak, as we age, what they are going to do, they are going to not help these bones to stay in a proper curvature. And as we lose this curvature, this is going to create more and more friction at more and more places, leading to disc problems. Okay. So you can see here, these muscles are called as trapezius, then infraspinatus, teres minor, teres major, latissimus dorsi, external oblique, internal oblique, so on and so forth. Here in the neck, it is splenius capitis, splenius cervicis, and here it is levator scapulae. All these things are combined together: neck, shoulder, back, hip. All these things, they are clubbed together. Okay. And movements at shoulder, movements at hip, they're going to affect particular areas of cervical spine, particular areas of lumbar spine, so on and so forth. So ultimately, what happens? This disc, it jets out and then it starts pressing on the nerves. Okay, that is what happens. Or else, with the age, these bones, the ligaments which are attached, they become more and more big. And these things, that is annulus fibrosus or anything, these materials, they are weak. So they are very fragile now. And they sometimes, the jelly material inside the disc, it pops out and it starts pressing the nerve root. You can see here, that is what has happened. Okay. And it is a natural process. Anybody on this planet can have this. Everybody on this planet will have this. The only problem is that if we maintain good muscle tone, these are the muscles which are supplied by the nerves. If we maintain good muscle tone, then we will be able to relieve ourselves or prevent ourselves of maximum damage, can minimize the damage. Okay. Now, in active pain, problem is in active pain, this is very, very important diagram. Suppose in active pain, the disc has prolapsed and it is pressing the nerve. What's going to happen? The nerve is going to get irritated and it will keep the muscle tight. So many of you have felt this. Many of you would have felt this. This is something called as paraspinal spasm. Paraspinal spasm. And it will pain a lot. The muscle will be tight, a lot tight down there. Okay. Specifically, if you think that somebody has undergone surgery and in that process, the spasm and all these things are further difficult and further complex because we would have done surgery from here, we would have removed the bone support, we would have done and exposed the thecal sac, and then we would have damaged some muscle tissue already because of the surgery. All these things combined together lead to lot other problems and lot more of the spasm, lot more of feeling of uncomfort in the back or the neck region, wherever surgery is performed. Okay, so that is where it's very, very important. See, all these muscles are supplied from inside through the spinal canal. The nerve roots are coming out, and then they supply the whole musculature, skin, everything. It's very, very important that we understand this, so we know that where is our pain coming from. Okay. Now we will not go in further details of this. So you have understood one very basic aspect, that it is the nerve which gets pinched, which is already supplying the muscle. So because of that, the muscle comes in spasm. And if muscle is coming in spasm, it will hold the bone and the nerve in a single place, a tight place. And that is why pain will keep on increasing. Most important thing to start with in any yoga therapy to any back pain patient is to relax the patient. It is to relax the patient. And that's what we are going to do as the beginning process. And then we will slowly build up to gently bring back the curvature of the spine. Because we want to bring back the curvature, we want to bring back the posture, correct posture. When we do that, automatically the things will fall into place. My humble request, please do not consider this video as a replacement to consultation, replacement to individual or personal classes or yoga therapy classes for yourself or for your family members. This is a session for awareness and motivation. Okay. And if you feel that this is, if you want to try, you try in a very gentle manner. You understand the limits of your body, you understand the pain which you are having, and accordingly you practice. However, this first step which I'm going to show you is never going to harm you. It's always going to soothe, relieve. It is always going to help overall. Okay. So this I'm not going to repeat in between. I'm going to continue the slow, gentle modification, relaxation of the spine. Okay. I'll change the mic so that mic and camera, so that you can see better and hear better. I hope you are able to hear me better now. Okay. And if you are able to hear me better, please thumbs up. Thank you. This similarity applies to all, like it applies to the back pain patient, neck pain. Neck pain slightly more difficult because it is high mobile, and that's what we have to understand. And then according to that high mobility, you have to bring a nice heavy relaxation also. Okay. Where are you? So here we are. Okay, I'm going to lie down. So best is to lie down on hard surface. Suppose you are not comfortable lying down on hard surface, then you should lie down on bed. You should lie down on blanket or whatever comfortable you can make yourself, not a problem. But ideal is lying down on the hard surface. And then completely relax, completely, you have to observe your toes, move your toes, feel them, and order them to relax. Move your feet, and then order your feet to relax. Move your calf muscles, relax. Feel your thigh muscles, hip muscles, and then relax. Relax your lower abdomen. Relax your lower back. See, these instructions one has to give oneself when one is relaxing, and then
keep on assessing whether the relaxation has been achieved or not. And gently focus on the umbilicus. To deepen the relaxation of lower body, we are going to chant Akara 3 times. The sound vibrations are going to relax the lower body. Inhale. Excellent. Now, next thing which we are supposed to do is continue this relaxing wave upwards. Relax your lower abdomen, middle abdomen, upper abdomen. Relax your chest muscles. Relax your thoracic cage muscles. Relax the muscles around the spine, paraspinal muscles in lower back, in middle back, in upper back. Relax your shoulders. Relax your biceps. Relax your triceps. Relax your forearms. Relax your palms, your fingers. Focus on the center of the chest. Let us chant Ukara. The vibration of Ukara should relax our trunk further and add to the relaxation of the whole trunk and the lower limbs and upper limbs. Let us do that. Inhale. Slowly, the relaxation. Focus at the junction of neck and the shoulder. You can feel that there is a tension over there because the rest of the body is relaxed. Neck and the head region is yet to relax. So order your neck muscles to relax, both front and the back neck muscles. Relax your jaws, relax your tongue, relax the muscles in the face, relax your eyeball muscles, relax your eyelids, your eyebrows, your forehead, your top of the head, back of the head, everything relax. Focus on the center of the eyebrows. Let us chant Makara, humming bee sound 3 times. Mm. Excellent. Browse through your whole body. Feel the deep relaxation. Now gently let us chant A, U and Makara 3 rounds. In a single round, 1:1:2. That is if you chant Akara for 3 seconds, Ukara for 3 seconds, Makara for 6 seconds. Let us do that. Excellent. In this deep relaxation, take a sankalpa. For example, I have achieved great physical, mental, social, and spiritual health. Or, for example, I have achieved freedom from my neck pain and back pain. Or, for example, I have improved my posture to the best human possibility. Or, for example, I have achieved ultimate happiness in my life. Or, for example, I have achieved peace, prosperity, health, and happiness. Chant it 9 times within your mind. After sufficient relaxation, after chanting your sankalpa for 9 rounds, gently wiggle your toes, wiggle your fingers, move your legs, bring them together. Take your both the hands up, feel the stretch, and then fold your both knees like this. And then gently open up. Do namaskara with the legs. Relax your elbows. This is called as Supta Baddha Konasana. This is one of the most powerful asanas to align your shoulders, to align your spine, to align your hips with each other. Just breathe deeply, slowly, and smoothly. And then relax. Open the hips. Allow the body to completely surrender to Mother Earth. Where is the key here? To keep holding back the body, it will not realign. Just release it on the floor. Surrender yourself to Mother Earth. Anyhow, one day we all have to. Why not today? Enjoy this beautiful experience. Gently, after some time, straighten your legs without lifting your knees. Gently let it go. Once again, Shavasana. Now we do one leg Pavana Muktasana if it is possible. We have to assess the patient and we have to see whether they are able to do it or not. With exhalation, create that crunch. With inhalation and exhalation, release leg. Inhale, fold the leg. Exhale, bring it closer. Inhale, exhale. Suppose one is able to do, then we should let them do 4 or 5 rounds. After that, both the legs together. Inhale, exhale. Feel that nicely. Inhale, exhale. Suppose this works, then in between we can use chair also. We'll show you the use of chair with Karni. Yesterday we had done chair with Karni. So you can allow the back pain patient to relax in chair with Karni for 20 minutes. That itself starts solving lots of problems, relaxes all the paraspinal muscles. Suppose we are able to do that after relaxation. Try to straighten the knee and lift the leg up like this. It helps a lot. Exhale. Inhale. Exhale. Inhale. Exhale. This also can be repeated if one is able to do that. Okay. So the chair thing is over. Now, lying down ulta. He wants to come out. Never try to come out fast. Always remember there is some problem, there is back pain, there is some compression of the nerve. So very, very gently one has to use the body. Okay. Lie down ulta on your tummy. The relaxing posture is Makarasana. The relaxing posture is Makarasana. So you can see here the ankles are pointing towards the center. The body is completely surrendered to the mother. Right hand on the left shoulder, left on the right shoulder. Relax completely. Okay, now that thing is coming because there is a reflection of tube light here down on the tiles. That yesterday what I spoke, I will speak. I spoke to one of my residents in surgery here. Told him that in the era of tube light, be sunlight. So you have to be a greater light. Okay. You have to be a light who is responsible for over life on the planet because tube light will not give life. Sunlight will give life. So don't be a tube light because tube light consumes energy. And sunlight radiates energy, gives energy to all of us. I hope it's a deep philosophical thought of understanding of giving meaningful aspect to others, giving meaningful aspect of yours to others. Just don't shine for yourself, shine for others. This is Makarasana. Then next is Bhujangasana. If suppose one is happy lying down like that, one should try Bhujangasana. Bhujangasana. Hands, palms by the side of the chest, elbows closer. Inhale gently. You should always assess whether you are successful or not. Inhale, come out. Exhale. If suppose this is happening and it is feeling good, one should continue.
Disconnected, doctor.
Yes, it is disconnected.
I think he's having internet issues. He's trying to reconnect back.
Might be.
Yeah, he may have a power problem, I think.
Okay, so there was some problem with internet. Are you able to hear me?
Are you able to hear me?
Yes, doctor.
Yeah, there was some problem with internet. Have potentially sorted it out. And we are running out of time. I was in Shashankasan. From Shashankasan, I will show you what we are going to do. Okay, and then maybe we will just relax to do what do you call it as Merudanda Mudra. Just a second.
I hope once again. And so I will change from Shashankasan to once again Makarasan, and then we will sit for a while in a chair. For anybody who has back pain, they're not comfortable sitting down, they can sit in the chair and then they can proceed. Yes, sir. Okay. So, went from Bhujangasana. Very easy. Everything is good and easy. Looking from Bhujangasana. So once again, going into Makasana. Very close to Madras and relaxing. Then we coming towards right, and then coming to sitting position. Or suppose this is one of the most favorite ways of addressing problems for people. Suppose you are able to sit on the floor, how is happening? You would have seen it in the problems. And we do this sitting with support of the wall, we this we know that the Mudra has many a number of people. Chin Mudra on the left hand, Chin Mudra on the left hand, and then Madhyama and Kanishta on the right hand, touching the Angushta. This is Mayurvanda Mudra. This is Mayurvanda Mudra. Anybody who has spine issue should perform Mayurvanda Mudra. Okay. And this Mayurvanda Mudra, you can either sit freely, like right now I am sitting. Suppose you are having a healthy spine, you can sit just like that. Suppose you feel no, I want support from the body, So it's not compulsory. Nothing is hard line in yoga. In yoga, what we call as Nahatat, Namanat. What we call as Nahatat, Namanat. We don't want anybody to force anything on themselves. We want stiram, we want that chira. Practice means for a long time we should be able to practice. Our practice should not get shortened because we fought with our body and then we damage it. We should not do that. Okay, that is one very big aspect of yoga. And as we had understood and shared day before yesterday also, the very important and basic sutra for achieving greatness in yoga is Prayatna Shaitilyam Ananta Samavatilyam. Here it is. For Prayatna Shaitilyam Ananta Samavatilyam. So I wish all of you to practice this Nirvana Mudra and feel its great effect. Okay, right now we will close our eyes and we will practice. Feel the pulse, breathe slowly, deeply, and smoothly. Preferably 1:2. This is very, very basic practice. Maybe only relaxation can be done for some of the people, like yoga nidra only can be done. Some of people may not be able to lie down also properly. Then their legs can be lifted on the chair. That has been amazing for many people, and that is the best ways to relax. Prayatna Shaitilyam Ananta Samavatilyam. After sufficient relaxation, change the mudra to prana mudra. Prana mudra. All across the body. Round yourself.
చూస్తాం బెనిఫిట్స్ వేసి చూస్తాం
Namaskaram. Followed by Sarve Bhavantu Sukhina. Sarve santu niramaya. Sarve bhadrani pashyantu. Ma dukkha bhave. Shanti, Shanti. Keep your eyes closed slowly. Take both the hands back, hold your right wrist with the left palm. Inhale, out of the back, put your forehead to the ground. Express gratitude to Mother Earth Almighty, your parents and Guru. Slowly inhale and come up. Slowly release your hands. Rub your palms against each other in the feet or mountain. Keep them over your eyes. Shoulder, arms, forearms, chest, and hanging in the legs. If you release your eyes, namaste. And we are ready for training. If you have any
queries, doubts, you are most welcome. I request all of you, those who are regular practitioners of Brahma Muhurta Yoga, as many people as possible. We have a sankalpa of one country, and all of us together only can reach this goal. Okay. Thank you very much, everybody.
Thank you, sir.
Tomorrow.
Thank you. Thank you, sir.
Who is that?
Thank you, sir.
Himanshi. Oh, how are you, Himanshi? Hemo?
Fine.
Good, good. Okay. Badhiya. Okay, thank you. Thank you very much.
Thank you, sir.
Dhanyawada, doctor.
Thank you.
Something tomorrow.
धन्यवाद गुरुजी.
Tomorrow, if one of you wants to share your experience of Brahma Muhurta Yoga, we will do that like last week we had done with Manjula ji, and like that we can do. Okay, Sarita?
Okay, thank
You
you.
can message me who wants to share on a video. Okay, thank you.
Thank you.